Welcome to episode 7, if you will, of the Virtual Cafe. It is Cinco de Mayo. I want to say thank you to everybody who is joining us here today. Thank you so much for having us. For those of you who are familiar with the Virtual Cafe, I started this when the COVID situation was first happening, thinking maybe people needed to get out of the house a little bit, see each other, do a little bit of networking, and then I decided to maybe add a little bit of more formal structure with a guest speaker, and then leveraging Zoom's technology of the breakout tools. That's kind of the format for what this is. And so we've had a variety of interesting speakers along some productivity and some things like that. Last week, my speaker was a woman who was a fellow speaker with me at the Iowa Bankers Association. A woman named Holly Hoffman, who had been on Survivor 21 Nicaragua. And I invited her to share her story about resilience and coming back from challenging times and being uncomfortable. We then went into the breakout, and when we came back, somebody said we have a COVID survivor in our group, Joyce Bell. I said, who is that? And Joyce's voice popped up. Joyce and I were in co-working spaces together at Idea Lab, which was at the corner of Exeter and Newbury Street a number of years ago. We may not want to say how many years ago. I wrote my first book there. Bill Shander is here also. He was in the space with us. Bill designed one of my early logos. Lots of friendships came out of that space. And so Joyce and I had an hour conversation after the virtual cafe last week, just because I was just so speechless about what had happened. And so I said, would you be willing to share your story? And she said she would, particularly if whatever it can do to help people understand what it's like, and also some things to think about with all of that. I live near the State House, and yesterday there were protesters saying, I want to go back to work, and I'm like, I want to live. was my response. I'd like to go back to work. I'm actually working all the time, but I also really want to live, and when I know someone personally who has been through this. So Joyce, I welcome and thank you for your kindness and your time and your willingness to share your story. Just if you want to start from the beginning, how did you first kind of discover this was the situation, and what was that like to get that diagnosis?
Well, first, thank you, Diane, and thank you for all who are participating and for your interest. And I really hope, as Diane said, that we can all learn something from this and that some of my takeaways will resonate with you. I developed a cough where I couldn't really speak without coughing. I got chills, I got a fever, and I just had zero energy and was unable to eat for a week. And a close friend of mine had called and said, you sound horrible. And with me on the phone called a local hospital who said, go to CVS and pick up 4 things. Get Pedialyte, which will help with electrolytes, get Ensure, get melatonin, which will help you sleep with the cough, and get some Tylenol. My friend called with me on the phone, called CVS, and asked, would you deliver? And they said no. So I schlepped out with a mask, and I knew I wasn't feeling well, and I didn't want, unless I had a prescription, they wouldn't deliver. And I knew I wasn't well, but I schlepped out to CVS to get those 4 items. And when I got to my car, just for a minute, I put my head back and I was deep breathing. And I had not exerted myself. I had walked straight from the door of CVS to my car in the parking lot. And I just couldn't catch my breath. And I thought, this is beyond me. It's not just hunker at home and try to recover. And I had multiple friends who had similar symptoms, not the unable to breathe, but they didn't have a fever, and they were told, you're not eligible for testing. So I called my PCP, and as irony would have it, my PCP had referred me to a new PCP about a year earlier, and I had never met that person, not time for a physical yet. So I called my old PCP and asked, what testing could I have done? And I was sent to a respiratory clinic. It was an MGH respiratory clinic, and I went and literally schlepped from the elevator to a little folding chair, got all my vitals tested, and they came back 3 times to test. And the third time, when they came back the third time, I said, what is it you're not getting a reading on? And they said, oh no, we've got the readings and are sorry to tell you, but you're COVID positive and we have an ambulance on the way. And I looked at the guy and I was like, are you talking to me? And he came back with his little gloved hand with a sticky on it, and he showed me my stats. So I had a fever of about 101.6. My respiratory rate, which they want to be between 95 and 100, was about 90. But my resting respiratory rate, which is when you're sitting as we are now, should be about 14, and mine was 44. I just couldn't get my breath. So off I went in an ambulance. And when I got there and I went into the ER, I was to fill out, which I had, a form on my medical history. And the guy who, when I arrived, he's like, "You were supposed to fill this out." And I was like, "I did." And so he looks down at it and there's nothing checked. And he's like, "No medication, no asthma, no heart condition, no diabetes, no." And he's going through the list. And then he flips it over and sees I, in fact, had signed it. And in my limited ability to breathe and speak without coughing, I basically said, "Let me cut to the chase. Here's the sum total of my medical history. I had a broken ankle and thumb from sports accidents years ago. A couple of years ago, I got the flu, and I've taken maybe a half a dozen, aspirin in my life, period, full stop. There's my medical history." And I was like, "What am I doing here?" And he just sort of put his hand beneath my chin and said, "Trying to breathe." And I just looked at him like, good point. So next thing you know, chest x-ray, the whole bit. The next thing you know, I'm up in the ICU being told it's about 2 a.m. now, and I'm being told I'm going to get intubated. What that means is they take a tube that's about 18 inches long and they have to put it down your throat, and they attach to it a ventilator, which is going to automatically breathe for you. And when they do that, they have to very carefully regulate how much are you breathing on your own versus how much assistance is happening through the ventilator itself. And the goal is to allow your lungs to rest, to be able to fight COVID and regain the ability to breathe on your own. That's the goal. Of course, if you think about any time you've had a medical procedure, you've probably researched like crazy. What is it? What are the options? What are the side effects of any treatment? All of this. And here I am, a person who's been sick a handful of times in my life, being told I'm going down on a ventilator. And as I'm going down, they basically said, "You're going to have a team of 6 doctors, 2 nurses, a respiratory therapist. We will do our very best. You need to fight as hard as you can. You've got a 50-50 chance." I was mind blown. And the next thing you know, I'm in an induced coma. So they do that because it's very difficult for your body to avoid fighting the ventilator. It's very uncomfortable, and you're also probably going to be in a lot of pain otherwise. And so that 2 things happen. You're basically heavily medicated, and then you're also put on what they call a paralytic, which means you're paralyzed. You can't move. And the reason for that is that any movement affects your oxygen level. And so they need you still. And every single body function practically is hooked up to some machine or another, or that's how it feels. I was, again, absolutely floored. What would happen is they are constantly monitoring how your body is doing, because COVID is such a mysterious disease that it can change instantly without any warning, just like my breath. I mean, it wasn't as though I had symptoms for weeks and ignored them. I had felt lousy, really lousy, increasingly so for a week or so, but I wasn't unable to breathe. I was listening to Hunker at Home and Take Care of Yourself. And what would happen is you have a healthcare proxy. I had one. And right before, I had to fill out, and they certified a form so that they knew who to call. And my healthcare proxy was my mom. My mother was the person, while I'm in a coma on a ventilator, getting the calls regularly about status. And if you think about it, in some ways, it's worse for the people who aren't on the ventilator than it is for you. I'm out of it. They're not, my friends and family. And one of my dear friends created a Caring Bridge site where she reached out to family, to friends, and work colleagues to ask people, can you share your healing vibes, your prayers, your thoughts about Joyce? She's in a dire situation. So many people, to my shock, hopped on that and sent thoughts, prayers, healing vibes, posted pictures, sent messages, sending all of their strength. And every day the nurse would come in with the phone and allow my mother to speak to me. And I think there's a sense, and this again is one person's experience, but it's mine. I think there's a sense that when someone is not able to communicate, they can't understand you. And that is not true. I heard a lot of conversations between the nurses, between the doctors, and I heard my mom's voice. And once they allowed my significant other, Bob, on as well. And I heard those voices telling me, You're strong. You'll get through this. We're thinking of you. We're praying for you. You've got all your friends and family behind you. I learned that my friends had set up the caring bridge, and what was getting posted to it, I learned that everybody's plugging for me. So I had the sense of team. And when I think about the fact that a lot of people post-COVID get PTSD, and what they're finding is that it's caused by what you remember when you were under a coma. And whether that's real or perceived, it's what's vivid in your mind. And in my mind, what was vivid, when they said to me, you've got a 50-50 chance and I'm going under, my first thought was reaching to God. And I said, what do I need to do to earn a fighting chance? And what is it you want me to do with my life? And I will do it to the best of my ability. And that was my first thought. And of course, you don't get a clear answer. They think that's my job to figure out, working on that. But that was my first thought. My second was that I had lost my supremely close sister 2 years ago. And I was adamant that our mom is not going to lose another child. And that was very much a driving force for me. So I reached to her to ask her to be by my side in fighting this virus. And this is all in my mind, but this is where my mind went. And then I heard my mom's voice where she was sharing that all your friends and family are plugging for you. You have no idea how many people are reaching out and sending you vibes. So when we feel that there's nothing we can do to help someone, it's not true. And I would ask you to really think about sending those thoughtful feelings and the strength to someone, the prayers to someone, the healing vibes to someone, or the well wishes, whatever they are. And I do believe what we send out, we receive, and what people sent out, I received, and I'm very grateful for that. So my journey was, feeling that, and never once did I think I wasn't going to make it. And I contrast this to my roommate in rehab who went really dark and had lost her parents earlier in her life, went looking for them and didn't find them, and felt all alone, very alone. And I did not. I felt the power of team. And I think that made an enormous difference for me. I will say that I had the ability to raise 2 fingers, which was what they described to my mom as a wave. Joyce is waving. And I had the ability to turn the corners of my mouth into a smile. So she's waving and smiling. I think she hears you, is what they would say. And I had no concept of time. I got what they call ARDS, which is acute respiratory distress syndrome. And that's where here they were treating me. I was getting better. Then the symptoms exacerbated, and they needed to turn me what they call prone, which is on your belly, to try to get the fluid out of the lungs. That's something that requires 6 nurses and doctors to do. And you are put completely out when that happens. It's very painful and it's very dangerous. And then I was finally flipped back. And then I was weaned off multiple times where they were trying to allow me to breathe on my own in preparation for what they call extubation, which is when the tube comes out. And I was unable to breathe on my own sufficiently. And so multiple times I was told, I was very conscious when they weaned me off of the meds. I was doing the look, listen, and learn. I had a glass window. I could see every doctor, every nurse. I could hear all the conversations. And I heard from multiple people, multiple days, Joyce, today is the day the tube's going to come out. And it didn't. So I would watch the clock and I would wait and look and wait and look. And it kind of speaks to managing expectations. No one came back in to say, today's not the day. And I had no idea what a ventilator was or what was happening to me. I learned what I shared with you after the fact, both reading everything, going through my medical records, talking with the doctors, talking with my family and friends to learn what they learned during the process. I was very fortunate to have a friend who worked at MGH, a doctor there, who I had no idea knew I was hospitalized. And she had been texted by a friend the minute I went in. And every day she came up to see me, but I had no knowledge of that. So when she came to see me, I was out of it. All of my awake times, I never saw her. So in my mind, my immediate team are these incredible nurses and doctors who are putting themselves in harm's way with a contagious, active COVID patient, trying to help me survive. It is so humbling to be on the receiving end of that kind of care. And when I say to you, person after person, they would come in double masked. They would have their plastic shield that went beneath their chin. They would have plastic over their gowns, and they would have gloves. And I would listen. The nurses had 12-hour shifts, and I would listen when I was alert to them talk about the procedures and how they were going to do what they were going to do. They went through every supply in every drawer and talked about what I needed and how the order in which they were going to do it and what they were monitoring. And it was very apparent to me then how intricate what they were doing is, all the adjustments, all the measurements and whatnot. So they were very focused on my survival. And of course, when you are medicated, you don't necessarily realize the severity of it, the intricacy of it. Twice a day, there was a woman named Maria who came in to collect the garbage. And it may be surprising to you that I'm talking about that, but Maria, I don't know what else her job was, but her only job when I saw her, and it's a very dangerous job because of the germs, was to grab that bag out of the garbage. And every day she would call out to me, "Hello, Joyce, it's Maria. I'm here to get the garbage." And her visit I looked forward to because it made me feel human, not a specimen, not a patient, not someone whose input and output was being measured at every attempt at breath, at every input and output of your body. I mean, it was an important lesson to me about remembering to personalize. That meant so much to me, and hearing my mom's voice and Bob's voice did as well. So finally, there was a breach of trust, which was the fact that I was told for multiple days, today's the day. In the ER, there's no day or night because lights are always on. People are in and out all day long. It is incredible what they go through, the caretakers. There's no definition to the day or night. And so I knew that I had been told multiple times, and I came to believe they were lying, that I would never get this tube out and I would never get out of there. And then finally, a nurse came, one to the other said, "I just got the doctor's order. We're going to extubate Joyce." And I didn't know what extubate meant, but when I listened to what the nurse said, I knew it was me it was going to happen to, and I knew it was quite serious. And she said, "This is the riskiest thing we're going to do. Do you want to be in or out of the room?" And the second nurse replied by saying, "Why take two good nurses down?" And in my medicated mind, I interpreted that to mean if this nurse screws up on whatever she's going to do to me and I die, she's going to get fired, and this other nurse wants nothing to do with it. And that's where my medicated mind went. So the nurse goes out and watches from the glass door. And then I was extubated, and you have to participate as the patient where you have to give a deep cough. I thankfully was able to do that. It was quite a process, but I got extubated. So this tube came out, and my friend that's the doctor had said to me, "There's no way you could have felt the tube while it was in. You were on too much medication." But in my mind, it was excruciating. And again, it's hard to know what's real or perceived, but it is extraordinarily uncomfortable. And when you're weaned off and you're alert, I just wanted it out. And at one point in time, I had tried desperately to communicate, and they brought me a pad and pen. And the only thing I could get out was TH because I had no control over my hands because the paralytics. And all I could get out was TH. And I wanted to say two things. The first was thank you, because I was so grateful while I was there, seeing the care and knowing the risk they were putting themselves at and their extraordinary focus on the survival of the patient, which was me. And I wanted to say out. I wanted that tube out, out, out. So when the tube came out, my hands were untied. They have to tie your hands down because subconsciously you can try to pull the tube out. Then I was sat up. And every single member of the medical team at one time or another in the next hour came in to celebrate. It was such an amazing thing. This is exactly what we hoped for. You did it, when in fact they did it. You did it. This is exactly what we've been working towards. This is amazing. Congratulations. Person after person. I mean, they celebrated. And I am mortified to say, I'm not sure in my drug state that I remembered then to say thank you for my life. I think I was just in a stupor. I'm really not sure. I certainly hope so, but I'm not confident that at that time I was able to say thank you. It's because of you. So I was brought down to a COVID floor about 3 or 4 in the morning, and that's where you can have one caretaker in with you at one time. I'm still COVID positive. And there, opening my eyes was the first time that I saw my friend who's the doctor there, Kathleen, at the base of my bed. And it was the most beautiful sight to see someone that I knew. And to my surprise, she introduced herself. And I thought, did I have a lobotomy as well? Like, I'm looking back at her like, what? And she explains that people who have had the treatment I've had are going to be very confused. You're not going to remember anything or anyone for days. And you're going to forget things and understand it's part of what happens. And I had no voice, and I whispered to her, Kathleen, it's great to see you. And she knew I recognized her. I didn't experience what she anticipated there. I knew exactly. And right before leaving the ICU, they asked you, did you know your name? Did you know the date? And I said, April 2020, and it was May, because I had no knowledge that the time had elapsed and I had been under a ventilator for 11 days. I had no knowledge of that. And then they asked you if you knew where you were and why you were there, and I did. But my friend Kathleen looked at me, and she's accustomed to life and death every day, and she said to me, you need to know you are a medical miracle. You have been given the gift of life, and it's up to you to decide what to do with it. And the gravity of that from someone who I know to be a very pragmatic person was really profound. And in the next hour, I had an occupational therapist asking me if I could sit up and get to my feet. And think about it. Can you sit up and get to your feet? Well, oh my goodness, what a challenge. She had me stand, and showed me how she wanted me to do it, had me stand, and I needed the use of a walker. When I finally stood, I was asked if I could stand for 3 minutes, and it seemed like an eternity. When I sat down, she looked at me and said, you are a rock star. And in my whisper voice, I responded to her, we have different standards. I was mortified when I stood up. First of all, it took everything I had. I was so unstable on my feet. I was clinging for dear life to a walker. And when I looked down, my inputs and outputs were in bags. I was not managing my own bodily function. I had an oxygen tube in my nose. I thought I was breathing on my own. And someone's calling me a rock star? I can't even manage myself. And she sat down, and this was the right message at the right time. And she looked at me and she said, what are you thinking? And I said, how pathetic. And she looked at me and said, I want you to reframe. And that word reframe has come through my head again and again. And she said, do you have any idea what your body fought through and how amazing it is that within less than 24 hours of coming off a ventilator, you can stand on your own 2 feet? We are going to celebrate every single solid little movement because it's baby steps from here on out. And I am going to teach you to celebrate. And it was that reframe that I think is such a valuable takeaway when we think something's, just unacceptable, right? Reframe. I have tried to apply her lesson of reframe. I have to say that it was transferred to a rehab center. And in the rehab center, they tried to help me learn to swallow again. So there's the COVID battle, and then there's the battle of fighting a respirator. And both have impacts. You feel absolutely wiped out. You're exhausted. From the ventilator, I was unable to swallow, and my voice was very weak. And so you need to learn to walk again. You need to learn, without the use of a walker, you need to rebuild your muscles. And most importantly, rebuild lung capacity and endurance. And those are the challenges post-intubation that you need to master, and post-COVID-19 that need to happen. So I learned a lot there. And a lot of the takeaways that I have are illness can happen to anyone. I was the least likely person that I ever would have expected would have ended up in the ICU with COVID. Like I said, I've been sick a handful of times in my life. I have certainly tested my own endurance, overworking, not getting enough sleep regularly. I would also tell you I value my health, extremely, and I feel like I live my life in a way to do that, with the exception now I know of sleep. I need to get more sleep and do a better job of that. In the rehab, I asked, what do I need to do to resume my active life? I love to ski, I love to hike, I love to bike, play tennis, do yoga, do Pilates. I do all these things regularly. They're a part of my everyday week. How do I go from where I am to where I want to be? And unfortunately, there is no plan because COVID is too new, and every body reacts differently to it. So every specialist that I asked in the rehab center, including the doctors, would say, listen to your body. It will tell you it craves to heal. And what I learned about myself is that my strength is my weakness, which is determination might have gotten me through COVID, but my determination is getting in the way of me being able to listen to my body. To give you an example, when I got home, they told me get a shower chair, be on your first level the first week, just bird bath it. Bird bath it. I had been for 6 weeks or 8 weeks without a shower. Are you kidding me? So when I got home, of course, I marched right up the stairs, heading to the shower. When I was just trying to regain balance and strength, I walked up the stairs deliberately 2 times in a row, 16 stairs. And for your lungs, that's a lot when you're recovering from COVID. So I was out of breath at the top, and I must have stood there for 5 minutes evaluating, do I listen to my head, my determination, which says you do it 4 more times and you'll build the capacity? Or do I listen to my body, which is saying, that's enough? And I literally stood there for 5 minutes. I'm thrilled to say I listened to my body, but I did ask the doctor. I had spent time asking, what should I do? Because my natural drive is to say, push it, and that's how you move forward. This is what we do in our work. We push forward and we solve the problem, when in fact it's having the exact opposite effect, where it's putting you back. Sometimes less is more. And so I'm trying very hard to learn to listen to my body, but it's a lesson for me that learn to listen to your body. Determination is not always the right path. I will also tell you that, we control nothing. We think that we have control over things, and you can control your healing pace and you can control what happens to you. We don't. I look at the fact that I had no knowledge of what treatment I was given, of who was doing it, of what was happening to me until after the fact. I also want to say that to be on the receiving end of service, the way I experienced, the doctors, the nurses, every caretaker, every friend, it's so overwhelming. Service is such a beautiful gift, and I owe my life to it. When the doctors intubate and extubate, it is the riskiest thing they do. They are putting their hands right down the throat of a person who is COVID active. I can't think of being closer to the germs that can take your life than they are. And they are doing that day in, day out. And I just want to say we should all be recognizing and grateful for that, because their sole focus is how do they help you survive and heal. And I've never been on the receiving end of such selflessness repeatedly, person to person. The other thing I wanted to share was the power of team. And by that I mean that I mentioned to you that I felt the prayers and the healing vibes, and my mother told me, but I truly felt them. I want to say that send that out to others, because the power of that is incredible. The kindness of others in terms of the texts, the calls, the cards, the people dropping meals, getting my mail, just offering to do things for you. And I'm not just talking family and friends, neighbors who you feel like you barely know, who see you walking slowly. And what can I do to help? I mean, it's so incredible how much kindness we have to give one another. And I hope you'll give it generously, because I'm humbled to be on the receiving end of that generous gift. And lastly, I just want to say that your healthcare proxy, your will, your power of attorney, I don't know if you have it. I don't know if it's been updated, but I want to ask you to really think about your healthcare proxy. I had one. I never thought I'd need it at this stage in my life. And you never know, your health can change in the blink of an eye, as mine did. And I have to say that a healthcare proxy, make sure you discuss with them your wishes, and make sure you recognize the position they're in. My mother was asked if I should be put on drug trials. These are drugs that are not tested drugs, that they are trying to use to learn, will they help COVID patients? They have nothing. We don't know what a cure is. And so they're throwing the kitchen sink at it. And my mom had to make those decisions without my input, without really knowing what are the pros and the cons. You're given the thumbnail sketch that they have, and she had to make those decisions. So I want to make sure we each recognize the responsibility that we are putting on our healthcare proxies, making sure that we're very active about having one, discussing our wishes, and also not judging the decisions someone makes, because you never know what you would do in that situation, particularly when there could be side effects if you say yes, there could be death if you say no. I mean, it really is remarkable. And I just wanted to share, this is personal, but I wanted to share it. My mom wrote a poem, and she posted it to Caring Bridge, and it really captures so much of what I feel. So I just wanted to share it with you. We've got her back, to all you friends, you lovely friends, who cheered her on, who sent their love, who felt her pain and vibed her back to life again. She's standing there with arms outstretched, relishing air with every breath. She felt your prayers, your photos, your poem, your music, your song, your voice, your messages, your hope, Kathleen, your care. The staff all came through, loud and clear, osmosed their way in, those she couldn't hear. They pulled her out of her padded cell and brought her back to being well. Now all, feel it, catch it, love it, do, grasp her thanks to all of you. Here's to her, here's to you. Keep safe and well, and God bless you.
So I'll just say thank you again, Joyce, for your courage and your amazing story. I just want to say thank you to all of you who have shown up today and have been a part of my life for today. And I would invite you to just take this time and maybe make a call and just express some friendship for somebody who you maybe, it's someone's been on your mind, or there's been sort of an opportunity to reconnect and it's been a while. So I just want to say thank you. Have a wonderful Cinco de Mayo. And this is a celebration of life for Joyce and a celebration for us to care for each other in ways that we have no idea. So many blessings to everybody, and I will hopefully see you all next week.